Taking the patient's health history into consideration, begin the examination. Begin by inspecting the anterior and inferior surface of the nose. Notice the symmetry and deformity. A little deformity or asymmetry on either side is normal. Press one side of the nasal passage and ask the patient to breathe to examine if there is any congestion. Use the otoscope to focus in the vestibules and observe them. By pressing on the tip of the nose, by tilting the head a little backward, you can observe the vestibules. With the help of the gloves, examine the external surface of the mouth and the lips. Use tongue blade to examine the inside of the mouth for any ulcer or candida infection. With the help of the gloves, observe properly the infection or ulcer or candidas inside the mouth. Examine the tongue of the patient. On both the sides for ulcer. With the help of the tongue blade, depress the tongue to get the view of the soft palate and the uvula. Ask the patient to say ah so that you can observe the movement properly. For the examination of the neck, begin by examining the symmetry while standing in front of the patient. Look for any enlargement or scars or masses. Look for enlargement of the submandibular gland. Try to palpate the lymph nodes. Ask the patient to relax and the neck flexed frontly. Palpate the anterior. Palpate the lymph nodes and try to examine the trachea and the thyroid gland. Look for the isthmus and both the lobes. Try to locate the lymph nodes. Ask the patient to sip some water. Again, observe the movement of the trachea. And ask the patient to relax. Palpate the supraclavicular nodes. Examine the submandibular and other lymph nodes. With the help of the tangential light, you should be able to see the shadow of the thyroid gland. Ask the patient to sip the water. Observe the upward movement of the thyroid. Confirm your visual observation by palpating the thyroid gland. You can use the stethoscope to listen to the sound of the lateral lobes of the thyroid.